Hi, my name is Isela Trinidad, and I assigned myself gonorrhea to work with. Gonorrhea is an STD, a sexually transmitted disease that is caused by infection with the Neisseria gonorrhoeae bacterium. It infects the mucous membranes of the body, and this STD is more prevalent in younger populations. And while it is one of the more common STDs, it is important to be knowledgeable about the bacteria as a whole. The signs and symptoms for gonorrhea are very easy to detect because of the unpleasant feeling. However, because the symptoms are very similar to other STDs, it can create room for a misdiagnosis. A good way to confirm that it is gonorrhea is by doing a nucleic acid amplification test, which is also known as an AAT test. A urine test, a swab sample are also good ways to look and confirm that gonorrhea is the infection going on. The signs and symptoms of gonorrhea are both present in males and females. Both will feel itchiness in the throat, pain in the anus when pooping, or even a burning sensation. Men will have discharge coming from the tip of the penis, which would be a green-yellowish color. They will also experience pain in the testes and inflammation of the foreskin. Women will feel pain when urinating as well and will have the discharge that is thin or watery with a similar greenish-yellow color. They will have heavier periods and can bleed during or after sex if it is very severe. Gonorrhea is caused by Neisseria gonorrhoeae bacterium, and this bacterium is a gram-negative bacteria that has a Diplococcus morphology and only infects humans. It infects many parts of the body by entering through the mucous membranes like mentioned before, and it can affect either gender, male or female. The pathogenesis of gonorrhea can be explained in 7 steps: transmission, attachment and colonization, invasion and inflammation, immune response, tissue damage and dissemination, antigenic variation, and lastly, persistent infections. Gonorrhea is a sexually transmitted disease, so in order for the bacteria to be transmitted into someone else, some sort of sexual activity, whether that be vaginal, oral, or rectal, needs to occur with someone who has been exposed and is currently carrying the disease. Gonorrhea likes to attach itself to the mucosal epithelial cells that are found on the mucosal membrane of specific body parts. The bacteria has pillars and other adhesions that help it attach and colonize to those specific cells. The bacteria easily invades the epithelial cells and can go through epithelial tissues. This specific invasion is what triggers gonorrhea to release the toxins that it holds, and the body then calls for its own immune system to start fighting off the infection. When gonorrhea spreads to other organs of the body or tissues, the bacteria can begin to spread like wildfire and bring havoc amongst the infected person. The immune response done by the immune system then allows the person to demonstrate some sort of symptoms, whether that's the painful urination, the inflammation of the foreskin in males, or just the heavier menstrual period in the women. And these symptoms are very useful because they could allow the person to go get tested and seek some type of treatment plan that could efficiently and quickly help them resolve the problem. However, in cases where gonorrhea has spread to other tissues and organs of the body, a lot of cases, the problems could be resolved, but it's just more painful and takes a longer time to recover. However, it's important to recognize that gonorrhea is one of many bacteria that uses antigenic variation. And antigenic variation changes its antigens and makes the bacteria irresistible to the antibiotics that could usually treat it. Antigenic variation is not something that someone wants to deal with when it comes to fighting off a disease like gonorrhea because it challenges the body's natural immunity. Lastly, it's important that people get tested if they feel some sort of discomfort or know that they have been with someone who has previously had gonorrhea because it can genuinely stop the spread. Not getting tested or treated for this bacterial infection not only puts you at risk, but also other people who you decide to be sexually active with. Epidemiology is a study of distribution and determinants of health-related states among specific populations and the applications of the study to the control of health problems. As of 2020, about 82 million people have had gonorrhea before, which I personally found surprising considering that there are many ways to have safe sex. Study shows that the common audience that gonorrhea targets are those who are new in sexual relationships and those who are sexually active but are not aware that they have contracted it. The age varies from about 15 to 49 years old, and gonorrhea is more prevalent in populations where men were having sexual intercourse with men, transgender women, younger unprotected males or females, and sex workers. And while gonorrhea has decreased globally, it has increased nationwide. So specifically talking about the United States. It's currently ranked as the second most common STD in the nation, and a lot of cases go unknown or untreated because of gonorrhea's antigenic variation, which could be one of the multiple reasons for why gonorrhea is still very, very prevalent in today's society. Like any other disease, gonorrhea has its prevention methods and treatments. People can prevent gonorrhea by having simply protected sex. Utilizing tools like condoms is one of the most effective and safe ways to prevent yourself and your partner from contracting the infection. Nonetheless, abstaining from sexual activity can also help prevent the spread, and that doesn't mean not being involved sexually, but maybe refraining from having sex with someone who you may not know completely or do not trust could really, really help you and someone else. Getting tested regularly for STDs is good for yourself and your community. Not only will you help yourself get diagnosed with anything were to be in your body, such as gonorrhea, but you could help cure or diagnose someone else before it's too late for them. Treatment methods for gonorrhea can be done both by an injection or orally. Ceftriaxone can be administered by your doctor to be injected and help you fight off the infection. But if for some reason that doesn't feel comfortable, you're allergic to ceftriaxone, or you want to see other options, oral medications are also available. Azithromycin and dioxycycline are available, and it is important to recognize and know that these medications should be ordered and monitored by your doctor or physician if you were to have contracted gonorrhea. And lastly, we're going to talk about the Christian worldview perspective on gonorrhea. While the Bible does not directly mention gonorrhea or any type of bacteria, references and thoughts can be made to help understand why things like gonorrhea exist. 1 Corinthians 6:16 says, "Flee from sexual immorality. All other sins a person commits are outside the body, but whoever sins sexually sins against their own body." I think this Bible verse honestly brings awareness not only to the self-respect and morality that we must carry as Christians, but it's also essential to understand how important our bodies are. God made them in His image, and it's important that we treat our bodies like a temple. And then the other Bible verse that I chose was Colossians 1:16, for it reads that, "For by Him all things were created in heaven and on earth, visible and invisible, whether thrones or dominions or rulers or authorities, all things were created through Him and for Him." This verse allows us to comprehend and understand that bacteria and other diseases may not be good, but there was intent, and God had that intent already set. He gifted people the intelligence and persistence to find treatments for these life-threatening bacteria, and without His grace, who knows if there would be a real cure to diseases like gonorrhea. All of this can be justified by God's goodness and His care for us, that He is willingly gifting people the ability to research, give them the strive, and bless them to keep going and really pretty much find cures for diseases like this. And gonorrhea is just one example, but there are millions of other diseases that still have no cure, where God can still send all of His blessings to help find those and help treat those who want to be treated realistically. And then this last slide is just my references.